Welcome to RUMC Vital Signs. My name is Alex Lutz. On our show, you'll meet the fantastic people who make Richmond University Medical Center thrive. RUMC is an award-winning full-service hospital located right here on Staten Island at 355 Bard Avenue. To learn more about the full array of services provided at RUMC, visit www.rumcsi.org. The Richmond Health Network was launched in 2020 to provide Staten Islanders with improved access to quality primary care and specialty medical services through a series of private offices and centers across the borough. Since its inception, the network has now grown to over 20 locations and also has offices in Brooklyn and Manhattan. Joining me today is Jeffrey Lieto, Executive Vice President of the Richmond Health Network. Welcome to the show, Jeff.
Thank you so much for having me, Alex.
Thanks for coming on. I guess the best place to start is tell us a little bit about the services available through the network.
Sure, happy to. It's a very comprehensive range of services we offer throughout the network. It starts with primary care. Most of our locations offer primary care through physicians and mid-level practitioners. That feeds in directly to many of our subspecialties, and we have a range of pediatric, obstetric, adult medical, and adult surgical, as well as pediatric surgical specialties to offer. Endocrinology, rheumatology, nephrology, pulmonary, those are some examples. Neurology, another medical subspecialty. In addition, on the surgical side, we have neurosurgery, bariatric surgery, general surgery. We have a full range breast imaging center followed up by breast surgeons. We can offer services to the young, women expecting babies, and to families. We round out the scope of services with some of the more important support elements, such as mental health and well-being, social services, diet and nutrition, and those types of things that round out care in a comprehensive way. There's really no aspect of health delivery that you won't find in place at one of our Richmond Health Network locations.
So it sounds like a really comprehensive network. When you're determining services, I mean, primary care, obviously, kind of the doorway, I guess, to a lot of specialty services. When you decide to enter into specialty services, have these services available through the network, how do you determine what services to offer?
Sure. I mean, it's two broad areas of focus. Most importantly, access, availability. One thing as a deliverer of care that I don't want to ever have happen is having people need access to physicians and finding out that appointments aren't available for weeks or months to come. So we measure access by each of our 80 or so specialties every month. And whenever it slips beyond about 10 days, we add physicians or mid-levels in that specialty so that access gets shortened. So that's one thing we do. And the other thing we do is we look at comprehensiveness. We make sure we have a sufficient panel of providers, a slate of hours, and appointment availability in all of those specialties that I mentioned before.
And when you actually look at putting a service together, are you also examining community need?
Yes, absolutely. So, what we know by being a full-service health delivery system, it's important to punctuate that the Richmond Health Network and Richmond University Medical Center, their strategy and fold-out for delivering care is comprehensive. It takes a look at every public health indicator, every community health indicator for the borough of Staten Island. We know how many people we have. We know where they live. We know what disease incidence is by zip code. And we try to focus the growth in the availability of services and the depth of services to respond specifically to those needs in the community. So there's a lot to be done. It's fascinating work. It's important work. And the fact that it's being done collectively by the staff of the entire RUMC system, including the network, means it's targeted to the goals for improving and elevating health outcomes, reducing social health disparities, and improving health equity across all of our population.
And this is obviously not the first network you've put together, right? So how has that, I'll say, business model changed since when you first started to now?
Sure. So, in working for health systems, medical groups, what have you, over the years, it used to be the focus was on figuring out how physicians and hospitals aligned, meaning the business and even delivery drivers for a hospital and for the medical staff often were at odds with each other. From a reimbursement example, one is length of stay. It used to be that hospitals tried very hard to reduce length of stay, and physicians argued very vehemently to keep patients in hospitals as long as possible. Somewhere in between the two is the right length of stay. So over the years, and that's a 30-year-old struggle that we had. The good news is over the years, what we've gotten is what we call hospital-physician alignment. So the goals for delivering care, the goals for being reimbursed, and the goals for being rewarded for providing efficient care with good health outcomes are pretty much the same for the hospital and for the physicians. So it makes somebody like me, who kind of walks with one foot in each camp, always thinking of what's best for the hospital and its mission in delivering care, and what's best for the physicians and their mission for delivering care, makes my job much more interesting, easy, and fulfilling to know that there's so much so much alignment and overlap. It's not always 100% overlap, but there's more than enough in place that hospitals and physicians are now teammates, doing the same things for the right reasons to try to elevate the best care that we can for our patients.
So is it fair to say that a number of procedures that you might have in the past only found in a hospital are now being done on an outpatient basis through things like the network?
Yes, absolutely. There's a huge migration in the health delivery model to the outpatient and ambulatory setting. There's also a reduction in the average length of stay. A lot of procedures that used to take a week or more are done in the same day, even within the hospital setting. So one of the missions of the healthcare delivery system is to be efficient and to get as much as we can get done in a reasonably short period of time while keeping an eye on safety, quality, and safe and full recovery. So much more has migrated out to the offices and to the centers. We do endoscopies, we do various OBGYN procedures in some of the OB offices. We'll be doing some office-based procedures in urology shortly. A lot of the minor general surgical procedures can be done right at the office. Our ENT, ear, nose, and throat physicians do a lot of nasopharyngeal scoping in their offices, and that used to be done in hospital settings or surgery suites. So yeah, more has been moved there, but there's always going to be the line of things that can only be done at a hospital, and it's not something that is a network's only decision. These are standards of practice and standards of care by specialty that physicians know, what gets done in their office, what gets moved to a surgery or procedure center, and what gets done at the hospital in an OR.
And as someone who's had procedures in my physician's offices, it's so much easier and convenient to know that I'm getting cared for and can either drive home the same day or I'm relatively close to home, as opposed to entering into a hospital facility itself.
Absolutely. It's very proper that something that's going to take 30 or 45 minutes gets done that quickly, and recovery is usually only about 2 hours, and patients are home with their family and their prescriptions instead of being put into a more complex, longer process at a hospital. Although if you have to go to a hospital OR, ORs are really nice. We just finished investing a whole lot of money, and we have the most modern, state-of-the-art hospitals in the country. So wherever you land as a patient of RUMC or Richmond Health Network, you're going to get modern, efficient care in a nice setting with people who really care about you. I should mention service for a few minutes. The thing we focus highly on is the patient experience. We train all our staff in standard ways to treat people with respect, empathy, and compassion in a manner that's consistent with the RUMC mission, vision, and values, and the network mission, vision, and values. If you look at them side by side, they're almost identical. It's about empathy, compassion, caring, listening, and following through on people's needs, no matter what it is.
And I know it's got to be, and I know from my own experience, it's refreshing to be in a hospital setting and see the doctor that you saw in the office walking the halls, coming to see you if you're there for a more advanced procedure. Tell us a little bit about some of the physicians and doctors that are in the network and their experience and the skill sets they have.
Sure. Again, with all the specialties we have, we could drill down starting from core service lines. So the way we organize the scope of services is we look at the broad areas: oncology, medical oncology, hematology, and cancer care, detection and prevention. And when people do get found to test positive for cancer, the models we use for getting them the best outcomes they can have, excuse me, in the world of cancer treatment. Cardiology, same thing. We're managing people with basic, simple cardiac needs, and we're managing people who need interventional procedures, placement of stents, angioplasties, and other more advanced procedures right at RUMC. We have affiliations with Mount Sinai for patients who may need open heart surgery. OBGYN, we do more than just basic obstetrics and gynecology. We have advanced maternal fetal medicine services. We offer perinatology. We have a neonatal intensive care unit. We have a pediatric intensive care unit. So going from basic primary care to the most detailed and intensive care for adults and children is something we have in place. Same thing with neurologic and neurosurgical services, orthopedics. We are there for the basic procedures, but we're there for the most advanced procedures needing the most sophisticated equipment and operating settings. The physicians in these specialties are eminently well trained. Many of our staff come from top medical schools, have done top fellowships, subspecialty fellowships. They have the types of experience that brings in best practice. And they have a network of colleagues in some of the major academic centers that they can continue to relate to and talk to for advances in the field. A lot of my day is spent hearing about what's new and different and better and how we need to bring it into the network and into RUMC. And that, again, is one of the most exciting elements of the job, being state-of-the-art and knowing that if you come to see us, you're getting the same level of care that you would get in most instances as if you went into the city or into Manhattan, we are the city, the other parts of the city, or to the academic medical center. So, very exciting. Same thing with our support services, diagnostic imaging, breast cancer detection and screening. We're state-of-the-art. We have top fellowship-trained physicians in the radiologic and pathology services. Our pharmacy has top people. So, whatever element of care comes into play, we do that very well. I have to make sure I talk about the care we provide for people with behavioral and mental health issues.
Sure.
With 500,000 people on Staten Island, it's very nice to know that RUMC and the network have risen to the need for behavioral health. We see 70% of all the behavioral health encounters for patients and residents on the island at some point in one of our many locations at RUMC for behavioral health. And, it's very same thing as we mentioned with the other core medical services. We have everything along the continuum we need to do, from outpatient counseling for adults, families, and children, to inpatient settings, to crisis management, being present in multiple communities, and integrating that under a model we now call collaborative care, where primary care and behavioral health, mental health, and well-being are built into one visit. So we look at the whole patient. Our model of care at the community level is called the biopsychosocial model of care, and that means we look at not just what's hurting you on your arm or your leg or your belly, but we look at what's going on with your view of life and your wellness. We screen everybody for depression and suicidal ideation, and we make sure that everybody leaves there feeling well, having their needs met, and sometimes their social profile. There's food insecurity, a lower level of health literacy and understanding of what's being told to them that we like. We work on that by building health education into their care. So we try to do it all, and we think we do it
Certainly
well.
sounds that way. It certainly sounds like you're doing everything there. I think the network is got all the bases covered, and it sounds like if there's advanced care that's needed, then that's where RUMC steps in. It's a nice synergy between the two. So good luck with the network.
Thank you so much.
Thanks for coming on. I want to thank Jeff for joining me today. To learn more about the wide range of services available through the Richmond Health Network and to find an office near you, visit the network website at richmondhealthnetwork.org. When we come back, we'll meet two network medical professionals who'll share insights into trends involving women's health on Staten Island and how their new office on the South Shore is making access to care easier.
I'm especially honored to be here with Dr. Tubman and our chair, Tim Harrison, whose leadership and vision has been invaluable in bringing this dream to life. Together, we've built not just a physical space, but a place where women can come together, find strength, and feel heard. At this center, women will find everything from health services to educational programs, counseling, support networks, and the full support of a phenomenal hospital in Richmond University Medical Center.
This is the season for giving gifts, and we stand today on the site of a major gift from the Richmond Health Network to the women and families of Staten Island, especially those who reside on the South Shore. RUMC and RUMC doctors have a long and well-deserved reputation for quality, compassionate, and conscientious women's care. Care in this area is a passion for all of us, and that is why so many women are choosing RUMC and RUMC doctors to be their primary health care provider on Staten Island. So it's fitting that the Richmond Health Network opens today the state-of-the-art Women's Center for Obstetrics and Gynecology, the newest, most sophisticated and thoughtfully designed treatment center for women on Staten Island.
All I can say is, it's more than just a business enterprise. It's more than just patient volume. This is a commitment to bringing new life into the world. It's what you do every day. You should feel great about that. Never take your eye off the ball. You're doing the work we all got into healthcare to do.
This practice is dedicated to providing a serene environment where all women feel heard, respected, and empowered. This vision would not have become a reality without the support of many. First and foremost, I want to express my heartfelt gratitude to Richmond University Medical Center Hospital Administration. Your belief in this mission and your unwavering support have been instrumental in bringing this practice to life. Your efforts in putting this office together and ensuring we have everything we need are deeply appreciated. I also need to acknowledge my incredible team standing here beside me. Your dedication, hard work, and commitment to patient care are the foundation of this practice. This journey is not just mine, it is ours, and I'm honored to work alongside with such talented professionals.
Welcome back to RUMC Vital Signs. I'm now joined by Dr. Ina Tubman, a board-certified physician in obstetrics and gynecology, and Leslie Potensiano, a physician assistant who works closely with Dr. Tubman. Welcome to the show.
Thank you, Alex.
Well, thanks for coming on. In your field of OBGYN, to make it short, are you seeing trends among women on Staten Island? Are they healthier? Are they more on top of their health?
I think we definitely see a trend where women are more aware of their health. I think social media has a big aspect to it where they see people discussing their own personal circumstances and they feel like maybe that's part of what they're feeling. Mm-hmm. And they bring it to the table, they come to us, seeing if that's something that we can address for them, but more importantly, because they want to take care of themselves as well.
Mm-hmm. So they're coming in more, I'll say, educated than
I do.
past?
As much as we hesitate to refer to Dr. Google or Dr. TikTok.
I was going to say Dr. Google.
We definitely want them to come to us with some knowledge. Does help us, but more importantly, they do have some education, so it gives us a little bit more room to talk more about what they're looking for.
Mm-hmm. And are you seeing trends among women in Staten Island?
I think we do see a lot more issues, especially as younger women are coming to the practice, where they are seeing a lot more problems with either their periods, even going further into menopause, where women are more aware of the menopausal symptoms that might be occurring, and they're curious and they're eager to find some type of treatment to make sure that they feel better.
So when you say you're seeing younger patients, how young are we talking?
We see them as early as puberty. So as soon as their period comes, if they're having issues with their periods and it's something that they're not maybe potentially comfortable speaking with their pediatrician about, they refer to the specialist, which is who we see.
And because I have no basis of reference,
Sure.
At what age should a mom take her daughter to see an OBGYN? Would you recommend?
Usually 17, 18, usually we like to meet the girls before they go away to college so we can educate them on birth control, on prevention, on period regulations and the signs and symptoms that are concerns. But because we are, the mothers know us and they are comfortable bringing their daughters to us instead of taking them to pediatrician a lot of times to address their concerns. And that's what's great about the OBGYN field, that we can take care of their daughters and their mothers and their grandmothers all at the same time.
How long have you been practicing there, Tubman?
It's almost 20 years at this point.
So you're seeing people who probably came to you as young patients are now bringing their kids.
Yes, I see the girls that I've delivered.
Wow.
Yes,
That's
that
gotta
go
be a
to
great
college.
feeling.
Yes, that's a wonderful feeling.
Oh, wow. That's great. But it also shows trust.
Yes.
And are you seeing any kind of health trends among here on Staten Island?
I mean, one of the biggest things that we see is because of the patients coming so early, we definitely do see that there is more issues that because they were not able to see it potentially in the past, maybe because they were younger, but more now that everybody's talking about it, that they are seeing the issues, like we said earlier, about the menstrual irregularities, or maybe even problems with sexuality, or problems with birth control. And that's one of the things that are our big forefront is we do want to educate the patients to make sure that they're aware of what's going on and be on top of the trends.
Do you also have a large percentage of your patient population that are dealing with menopause?
Oh, absolutely. Yes, we definitely have a lot of women, whether it's just menopause symptoms or even issues relating to getting older, whether it's incontinence or whether it's prolapse, or more importantly, the basic symptoms of menopause, which is the hot flashes, the mood swings, the sleep disturbances. So we definitely see that full gamut, but more importantly, they're aware and they want to be treated as well.
And how long have you been a PA?
I've been a PA since 1999.
So in your experience, how has the field of OBGYN changed? So you're obviously in the field longer, but I'm sure there's been changes since even you started.
Sure.
What are some of the changes that has happened in the field?
It's just evolving. There's a lot more options for women to take care of their concerns. There's so many more things we could offer to women to help them dealing with their sexuality, with their urinary incontinence as they're getting older, to control the abnormal symptoms that before they had to deal with. Now there's ways around it to help them.
And we had Jeff Lieto from the Richmond Health Network as a guest on the first part of the episode, and he talked about how a number of procedures that used to just be done in a hospital are now being done in offices in an outpatient setting. Are you doing that in the office yourself? Are you seeing that?
Yes.
Oh, absolutely.
We offer a lot of procedures in the office itself. We'll do colposcopies to check cervixes. We do hysteroscopies, which is a minimally invasive GYN procedure when we put a camera inside the uterus to look for polyps, fibroids, any lesions, and we could sample it to make sure it's not a concern that needs to be addressed further.
And all that's done in the office?
And that's done in the office under local anesthesia. Wow. In addition, we do other procedures in the office now, like for vaginal rejuvenation, for vaginal atrophy and skin condition of the vulva, to address women's sexuality, and many other procedures that we could do in the office that we didn't have an option to do before.
Wow. And well, let me start with this. Explain what a PA actually is.
Sure. PAs are physician assistants. Some are also known as physician associates. We are mid-level providers. So as a mid-level provider, we can do what the doctor does in the sense that we can see patients, we can assess them, we can diagnose, we can treat, we can manage them, we can prescribe medications, we can, in the office, do the procedures like Dr. Tubman mentioned. In the OR, we can assist in surgical procedures, and in obstetrics, as PAs, we can actually do deliveries.
Yeah. So you keep mentioning an office, and you guys are moving into a brand new office at 2935 Veterans Road West after being at 4360 Highland Boulevard for a number of years. Tell us some of the features of the new office you guys are moving into.
Well, we are very excited about this new space. It's large, it's spacious, it's beautiful. It's meant for a woman that when she comes into the office to feel comfortable, to feel safe, to feel special. So she doesn't only address the physical concerns that she has, but she couldn't address her emotional concerns, her sexuality, it's a comprehensive approach. And the space offers us the flexibility to bring other providers to our office to provide care, so it could all be done in one space, such as maternal fetal medicine specialist, urogynecologist, nutrition and weight loss clinic, and among other things.
You brought up a really good point just now. A lot of, I'm assuming, the patients that you deal with, there's an emotional side to some of the diagnosis that you're making. How do you handle giving that news to a patient?
I mean, the biggest thing in terms of patients, especially when it comes to their concerns, especially if they haven't been addressed or if they feel like they've been ignored, or if things are just, barreling down, we do definitely try to spend a little bit more time with them to discuss what the original problem is in the first place. And we do offer services to see if we can kind of help them further to make sure that they get the services that they need. But more importantly, sometimes they do need medication, and we do discuss with them the treatment options, and we give them all the options on the table, and we discuss it in length to make sure that all those concerns are addressed.
So there's plenty of privacy in the new
Oh,
new
absolutely,
facilities.
absolutely. And one of the best things, one of the things that Dr. Tubman might have alluded to as well, is that not only is this a beautiful space, but the rooms are bigger. The rooms are more spacious. They all have computers. They all have TVs. So it's a lot more technologically savvy, but more importantly, in an area where it's not a white, cold room. So it's a lot more inviting.
Well, that's actually my next question. When you guys, when they were planning the design of this office, I assume you had input into
Yes.
what were some of the things you wanted to see in there for your patients?
So this is a labor of love. Dr. Tubman, from the lighting fixtures and the beautiful chandeliers to the beautiful mirrors to the beautiful tiles, those are one of the things we wanted to bring our personality to the office, not just being able to walk into a space and saying that's ours, but we really literally from the ground up built it to make sure that it gave us not only a sense of security and peace, but more importantly to make sure that patients feel the same way. So when they walk in, it's beautiful. It's definitely a spa-like feel, but more importantly, an area that's professional and sophisticated. So when they come in, it's something that they can be proud of, that they come to this office, and we're more importantly proud of that too.
I got to be honest. I was in the office before Thanksgiving, and you just hit right on it. This feels like a spa.
Yeah.
I feel like I'm walking into Hand and Stone or Massage Envy, and it's really a doctor's office. And I think that probably puts people at ease. And I think that's great. I think you've definitely captured that. If there's someone who's watching this show right now who's looking for an OBGYN practice, why should they come to the Center for Assistance?
I mean, I definitely feel, at least for our core providers, we're female. And a lot of women want to be able to know that they're seeing females. And at the end of the day, yes, we definitely pride ourselves that we're great clinicians, but more importantly, we're collaborative. We discuss the cases. We know if one person is not there to see a patient or for some reason a patient needs to come in, we can always pick up where they left off. So being able to provide a care that's comprehensive, but more importantly, thorough, is important to us. And we know that when patients come, if they enjoy the care, if they're okay with coming in, that they're going to refer their friends and their family, which most often they do, which is definitely a compliment to us.
I was going to say referral is always the best.
Absolutely, yes.
So what made you choose the field of OBGYN?
So I always loved OBGYN because it had the full gamut of care that you can get. So from primary care, which is like gynecology, to emergency room setting, like where you are in labor and delivery, where you're constantly going back and forth, to surgery, where you actually get to go into the OR and to be able to do C-sections or hysterectomies. But more importantly, to be able to provide care to the full range, not just pediatrics or geriatrics, but to have that full gamut. And I think most obstetricians and gynecologists feel the same way.
Dr. Tubman, why did you choose the field?
I think it's a privilege to be able to take care of women from the very beginning of their life, from adolescence to teenage years, to taking care of them through their pregnancy and delivery process, to going to menopause. It's a privilege to be part of their life, and I just really take pride in doing it. It's so nice to provide the comprehensive approach to their care, and I just love the variety of everything I could offer to them and be their friend and their close coach on the side.
And it sounds like you're really giving generational care. You're
Yes,
seeing
we do.
different the fact that you're caring for kids that you delivered is that's amazing. That's amazing. Well, I want to thank you both for being on the show today.
Thank you for having us.
Thank you.
And good luck with your new home away from
Thank you.
home.
Thank you very much.
If you would like to schedule an appointment with Dr. Tubman at the new Women's Center for Obstetrics and Gynecology, please call 718-818-4361. I also want to thank Jeffrey Lieto again for joining us earlier in the show. Richmond University Medical Center has cared for Staten Island and the New York City metropolitan area for over 120 years. You can help ensure that care continues by making a financial donation to the hospital. Donations can be made in your name, the name of a loved one, or to honor a special nurse or doctor at Richmond University Medical Center. To donate, visit our website at rumcsi.org and click on the Donate button located at the top of the homepage, or you can call 718-818-2106. That just about does it for this episode of RUMC Vital Signs. Thanks for joining us. I'm Alex Lutz.